Okay, in this video we are going to learn motor relearning program of physiotherapy. Motor relearning program, first of all, many of you who are in this field and who are medical students or observers, they will definitely know about motor relearning program and what this approach is. It compasses, first of all, we'll discuss about motor relearning program so you can have basic idea about motor relearning program. Then later on we'll discuss about its technique and approaches and its wide topics that you should know. Approach, it encompasses an assessment as well as intervention scale and is based on theory of some neurophysiological or motor control origin. The purpose of any approach is restoring activities and participation. All type of neurodevelopmental approach work on the theory of repeated practice, force use or facilitated use. Facilitation. Motor relearning means you are re-educating your muscles to work like before. Before it was like earlier than injury, as it used to perform before injury, and then later on it lost its function, and after motor relearning you would re-educate your muscle to restore your lost task. Now their approaches facilitation mainly included skilled interaction between therapist and the patient and include specific therapeutic handling, manipulation of environment, use of verbal and non-verbal cues, and manipulation of environment to optimize opportunity for execution of effective movement strategies. Activation, actual production of movement response that result in reaching at a threshold for increasing neuronal firing. The next is inhibition. First we were discussing facilitation, then activation, and now inhibition. Decreased capacity to initiate movement response through altered synaptic potential. MRP theory. Okay, this is something like history of the theory. Carr and Shepard developed a motor relearning program for stroke that provides guidelines for a training program for stroke patient based on principle of neuroscience, motor control and learning, biomechanics, exercise physiology, cognitive psychology and human ecology. The main thing is assumption. It focuses on practicing of missing task component, practice of whole task and transfer of learning. The main assumption of underpinning the approach are that regaining activities of daily living after stroke require a relearning process that is similar to learning process of non-impaired people. In addition, practice need to be task and context specific. Normal movement is thought to consist of essential components that are used to perform many different activities. Now, what is the aim of motor learning program? The motor relearning program are the patient to relearn everyday tasks such as reaching, manipulation, balance, sitting, standing, walking, standing up, and sitting down, bed mobility, and oral facial function. This requires the patient to regain controlled muscle activity and normalization of movement components into functional synergies. To restore or maintain soft tissue extensibility, muscle strength as well as fitness. What are these points? These are actually the aims of motor learning program that enable a person who has lost his